Welcome to our deep dive into pathophysiological processes. In this video, we'll unravel the mysteries behind how diseases develop and progress in the human body. Pathophysiology bridges the gap between basic science and clinical practice, helping us understand the underlying mechanisms that lead to illness. By exploring these processes, we gain insight into why symptoms appear, how organs are affected, and what treatment strategies might be most effective. Whether you're a student, a healthcare professional, or simply curious, this journey will enhance your understanding of the body's response to disease. Let's begin by defining what pathophysiology truly means and why it's so essential in medicine. Pathophysiology is the study of the functional changes that occur in the body as a result of a disease or injury. Unlike anatomy, which focuses on structure, or physiology, which examines normal function, pathophysiology zeroes in on what happens when things go wrong. It explains how and why the body's normal processes are disrupted, leading to the signs and symptoms we observe in patients. Understanding these changes is crucial for diagnosing diseases, predicting outcomes, and developing effective treatments. In the next scene, we'll look at how pathophysiology connects with other medical sciences. Pathophysiology doesn't exist in isolation. It's closely linked with anatomy, physiology, biochemistry, and clinical medicine. For example, knowing the structure of the heart anatomy and how it pumps blood physiology helps us understand what happens during heart failure. Pathophysiology. Biochemistry provides insight into the molecular changes, while clinical medicine applies this knowledge to patient care. This interconnectedness ensures that healthcare professionals can approach disease from multiple angles, leading to better patient outcomes. Next, let's explore the general mechanisms that drive pathophysiological changes. The heart of pathophysiology are several key mechanisms that underlie most diseases. These include inflammation, cell injury and death, immune responses, genetic mutations, and abnormal cell growth. Each of these mechanisms can disrupt normal body functions in unique ways. For instance, inflammation is a protective response but can cause tissue damage if uncontrolled. Cell injury may result from toxins, infections, or lack of oxygen, leading to organ dysfunction. Understanding these mechanisms helps us recognize patterns across different diseases. In the following scenes, we'll break down each mechanism in detail. Inflammation is one of the body's first responses to injury or infection. It's a complex process involving immune cells, blood vessels, and molecular signals. While its purpose is to eliminate harmful agents and start the healing process, excessive or chronic inflammation can damage tissues and contribute to diseases like arthritis or asthma. Classic signs of inflammation include redness, heat, swelling, pain, and loss of function. By understanding the steps of inflammation, we can better appreciate how the body defends itself and why sometimes this defense can go awry. Cells are the basic units of life, and their health is vital for organ function. When cells are exposed to harmful stimuli, like toxins, infections, or lack of oxygen, they can become injured or die. There are two main types of cell death: apoptosis, which is a programmed and controlled process, and necrosis, which is uncontrolled and often harmful. Understanding how and why cells die helps us grasp the root causes of many diseases, from heart attacks to neurodegenerative disorders. Next, we'll look at how the immune system plays a role in pathophysiology. Immune system is our body's defense against infections and abnormal cells. However, sometimes it can become overactive or misdirected, attacking the body's own tissues. This leads to autoimmune diseases like lupus or rheumatoid arthritis. On the other hand, a weak immune response can make us more susceptible to infections and cancer. Understanding the balance of the immune system is crucial in pathophysiology, as it explains why some people develop allergies, chronic inflammation, or immune deficiencies. Genetic mutations are changes in our DNA that can be inherited or acquired. Some mutations have little effect, while others can disrupt normal cell function and lead to disease. For example, mutations in certain genes can cause cystic fibrosis or increase the risk of cancer. Understanding how genetic changes affect the body helps us identify at-risk individuals and develop targeted therapies. In the next scene, we'll discuss abnormal cell growth and its role in disease. Abnormal cell growth is a hallmark of many diseases, especially cancer. Normally, cell division is tightly regulated, but mutations or environmental factors can disrupt this balance. Uncontrolled cell growth leads to tumors, which can invade nearby tissues and spread throughout the body. Understanding the mechanisms behind abnormal cell growth is key to developing cancer treatments and preventive strategies. Next, we'll explore how these general mechanisms manifest in specific organ systems. The cardiovascular system is responsible for delivering oxygen and nutrients throughout the body. Pathophysiological processes like atherosclerosis, hypertension, and heart failure disrupt this function. For example, atherosclerosis involves the buildup of plaques in blood vessels, leading to reduced blood flow and risk of heart attack. Hypertension puts extra strain on the heart and vessels, while heart failure results from the heart's inability to pump effectively. Understanding these processes helps guide treatment and prevention. Respiratory system ensures that our body receives enough oxygen and removes carbon dioxide. Diseases like asthma, chronic obstructive pulmonary disease, COPD, and pneumonia disrupt this balance. Asthma involves inflammation and narrowing of airways, making breathing difficult. COPD is characterized by long-term airflow limitation, while pneumonia is an infection that fills the lungs with fluid. Each condition has unique pathophysiological features, but all impact the body's ability to exchange gases efficiently. Nervous system controls everything from movement to thought. Pathophysiological processes like neurodegeneration, inflammation, and trauma can disrupt its function. Diseases such as Alzheimer's, multiple sclerosis, and stroke each have distinct mechanisms. Alzheimer's involves the buildup of abnormal proteins, multiple sclerosis is an autoimmune attack on nerve coverings, and stroke results from interrupted blood flow to the brain. Understanding these processes helps us develop better treatments and support for affected individuals. Digestive system breaks down food and absorbs nutrients. Pathophysiological processes like inflammation, infection, and cancer can impair these functions. Conditions such as Crohn's disease, hepatitis, and colorectal cancer each have unique mechanisms. Crohn's involves chronic inflammation of the gut, hepatitis is liver inflammation often caused by viruses, and colorectal cancer results from abnormal cell growth. Understanding these processes is key to managing digestive health. Kidneys filter waste and maintain fluid balance. Diseases like acute kidney injury, chronic kidney disease, and glomerulonephritis disrupt these vital functions. Acute kidney injury is a sudden loss of kidney function, while chronic kidney disease develops over time and can lead to end-stage renal failure. Glomerulonephritis involves inflammation of the kidney's filtering units. Understanding these pathophysiological changes helps guide treatment and improve outcome. Endocrine system regulates hormones that control growth, metabolism, and reproduction. Disorders like diabetes, thyroid disease, and adrenal insufficiency result from hormone imbalances. Diabetes involves problems with insulin production or action, leading to high blood sugar. Thyroid diseases can cause too much or too little hormone, affecting metabolism. Adrenal insufficiency means the body can't produce enough stress hormone. Understanding these mechanisms is crucial for effective management. Musculoskeletal system provides structure and movement. Pathophysiological processes like inflammation, degeneration, and trauma can lead to conditions such as arthritis, osteoporosis, and fractures. Arthritis involves joint inflammation, osteoporosis is the loss of bone density, and fractures are breaks in the bone. Each condition affects mobility and quality of life in different ways. Understanding these processes helps in prevention and rehabilitation. Immune system disorders can be broadly classified in immunodeficiency, autoimmunity, and hypersensitivity. Immunodeficiency means the body can't mount an effective defense, leading to frequent infections. Autoimmunity occurs when the immune system attacks the body's own tissues, while hypersensitivity refers to exaggerated responses such as allergies. Each type has unique pathophysiological features and requires different management strategies. Hematologic system includes blood and its components. Disorders like anemia, leukemia, and clotting disorders arise from pathophysiological changes in blood cells or clotting factors. Anemia involves a deficiency of red blood cells, leukemia is a cancer of white blood cells, and clotting disorders affect the blood's ability to stop bleeding. Understanding these mechanisms is vital for diagnosis and treatment. Reproductive system is essential for producing offspring. Pathophysiological processes like hormonal imbalances, infections, and structural abnormalities can cause infertility, polycystic ovary syndrome (PCOS), and endometriosis. Infertility may result from problems with hormone production or reproductive organs. PCOS involves hormonal and metabolic changes, while endometriosis is the growth of uterine tissue outside the uterus. Each condition has unique challenges and treatment options. Infectious diseases are caused by pathogens like bacteria, viruses, fungi, and parasites. Pathophysiological processes include the invasion of tissues, immune responses, and toxin production. Each pathogen has unique strategies for survival and spread, leading to a wide range of symptoms and complications. Understanding the mechanisms of infection helps in developing vaccines, antibiotics, and public health measures to control outbreaks. Cancer arises from uncontrolled cell growth and the ability of abnormal cells to invade other tissues. Pathophysiological processes include genetic mutations, evasion of the immune system, and the development of new blood vessels to supply tumors. Each type of cancer has unique features, but all share these core mechanisms. Understanding cancer pathophysiology is crucial for developing targeted therapies and improving survival rates. Inflammatory diseases are characterized by persistent or excessive inflammation. Examples include rheumatoid arthritis, inflammatory bowel disease, and psoriasis. These conditions involve immune system dysfunction, leading to tissue damage and chronic symptoms. Understanding the pathophysiology of inflammation helps in developing anti-inflammatory drugs and other treatments to manage these diseases effectively. Degenerative diseases involve the gradual loss of function in organs or tissues. Examples include osteoarthritis, Alzheimer's disease, and Parkinson's disease. These conditions are often linked to aging, genetic factors, or environmental influences. Pathophysiological processes include cell death, protein misfolding, and loss of structural integrity. Understanding these mechanisms is key to developing therapies that slow disease progression. Metabolic diseases result from disruptions in the body's chemical processes. Diabetes, obesity, and metabolic syndrome are common examples. These conditions involve problems with hormone regulation, energy production, and fat storage. Pathophysiological mechanisms include insulin resistance, abnormal lipid metabolism, and chronic inflammation. Understanding these processes helps in designing lifestyle interventions and medications to manage metabolic health. Congenital disorders are present at birth and result from genetic mutations, environmental factors, or a combination of both. Examples include congenital heart defects, cystic fibrosis, and Down syndrome. Pathophysiological processes vary widely but often involve abnormal development of organs or tissues. Early diagnosis and intervention can improve outcomes for many congenital conditions. Trauma refers to physical injuries caused by external forces, such as accidents or violence. Pathophysiological processes include tissue damage, bleeding, inflammation, and shock. The body's response to trauma aims to repair damage and restore function, but severe injuries can overwhelm these mechanisms. Understanding trauma pathophysiology is essential for emergency care and rehabilitation. Environmental diseases result from exposure to harmful substances or conditions, such as pollution, toxins, or radiation. Pathophysiological processes include cell injury, inflammation, and increased risk of cancer or respiratory diseases. Prevention and early intervention are key to reducing the impact of environmental diseases on health. Aging is a natural process that affects every organ system. Pathophysiological changes include reduced cell regeneration, increased inflammation, and accumulation of cellular damage. These changes increase the risk of chronic diseases, frailty, and decreased resilience to stress. Understanding the mechanisms of aging helps in promoting healthy aging and managing age-related diseases. Stress is a response to physical or emotional challenges. Chronic stress can disrupt normal physiological processes, leading to increased risk of hypertension, heart disease, and mental health disorders. Pathophysiological mechanisms include hormonal imbalances, immune suppression, and inflammation. Managing stress is an important part of maintaining overall health and preventing disease. Nutrition plays a vital role in health and disease. Malnutrition, whether from deficiency or excess, can lead to a range of pathophysiological changes. For example, vitamin deficiencies can cause anemia or bone disease, while obesity increases the risk of diabetes and heart disease. Understanding the impact of nutrition on the body helps in designing effective dietary interventions for disease prevention and management. Toxins and poisons can disrupt normal body functions by damaging cells, interfering with metabolism, or blocking vital processes. Pathophysiological responses depend on the type and amount of toxin, as well as the route of exposure. Symptoms can range from mild irritation to life-threatening organ failure. Prompt recognition and treatment are essential for minimizing harm. Medications are designed to treat diseases, but they can also cause unintended side effects. Pathophysiological processes include drug interactions, allergic reactions, and toxicity. Understanding how drugs affect the body helps in choosing the right medication, monitoring for adverse effects, and adjusting treatment as needed. This knowledge is essential for safe and effective healthcare. Pain is a common symptom of many diseases and injuries. Pathophysiological mechanisms include nerve damage, inflammation, and altered pain processing in the brain and spinal cord. Understanding the sources and types of pain helps in selecting appropriate treatments, from medications to physical therapy and psychological support. Fever is a common response to infection or inflammation. It results from the body's attempt to fight off pathogens by raising its temperature. Pathophysiological mechanisms involve the hypothalamus, immune signals, and heat production. While fever can help control infection, very high temperatures can be dangerous. Understanding thermoregulation is important for managing fever safely. Shock is a life-threatening condition where the body's tissues don't get enough blood and oxygen. Pathophysiological processes include loss of blood volume, heart failure, or severe infection. Symptoms include low blood pressure, rapid heartbeat, and confusion. Immediate recognition and treatment are critical to prevent organ damage and death. Edema is the accumulation of fluid in tissues, leading to swelling. Pathophysiological mechanisms include increased pressure in blood vessels, low protein levels, or lymphatic obstruction. Edema can result from heart failure, kidney disease, or liver problems. Understanding fluid balance is essential for diagnosing and managing these conditions. Body maintains a delicate balance of acids and bases to function properly. Pathophysiological processes like respiratory or metabolic disorders can disrupt this balance, leading to acidosis or alkalosis. Symptoms include confusion, muscle twitching, and irregular heartbeat. Correcting acid-base imbalances is a key part of treating many serious illnesses. Electrolytes like sodium, potassium, and calcium are essential for nerve and muscle function. Pathophysiological processes such as kidney disease, dehydration, or hormonal disorders can cause imbalances. Symptoms range from muscle cramps to life-threatening arrhythmias. Monitoring and correcting electrolyte levels is vital in many medical conditions. Oxygen transport is essential for life. Pathophysiological processes like anemia, lung disease, or heart failure can impair the delivery of oxygen to tissues. Symptoms include fatigue, shortness of breath, and cyanosis. Understanding these mechanisms helps in diagnosing and treating conditions that affect oxygen transport. Blood clotting is a vital process that prevents excessive bleeding. Pathophysiological changes can lead to either increased clotting, thrombosis, or bleeding, hemophilia. Thrombosis can cause heart attacks or strokes, while bleeding disorders make it hard to stop bleeding after injury. Understanding these mechanisms is crucial for managing patients at risk. Autoimmune diseases occur when the immune system mistakenly attacks the body's own tissues. Pathophysiological mechanisms include loss of immune tolerance, production of autoantibodies, and chronic inflammation. Examples include type 1 diabetes, lupus, and multiple sclerosis. Understanding these processes is key to developing immunotherapies and managing symptoms. Allergic reactions are exaggerated immune responses to harmless substances like pollen, food, or medications. Pathophysiological mechanisms involve the release of histamine and other chemicals, leading to symptoms like itching, swelling, and difficulty breathing. Severe reactions called anaphylaxis can be life-threatening. Understanding allergies helps in prevention and emergency management. Both genetic and epigenetic factors influence disease development. While genetic mutations change the DNA sequence, epigenetic changes alter gene expression without changing the DNA itself. Environmental factors, lifestyle, and aging can all affect epigenetics. Understanding these influences helps explain why some people are more susceptible to certain diseases and guides personalized medicine. No organ system works in isolation. Pathophysiological processes often involve multiple systems interacting. For example, heart failure can affect the kidneys, lungs, and brain. Understanding how systems interact helps in diagnosing complex diseases and developing comprehensive treatment plans. This holistic approach is essential for effective healthcare. You've explored the fascinating world of pathophysiological processes, from basic mechanisms to their impact on organ systems and disease. Understanding these processes is the foundation of modern medicine, guiding diagnosis, treatment, and research. As science advances, new discoveries will continue to deepen our knowledge and improve patient care. Thank you for joining this journey into the mechanisms of disease. Stay curious and keep learning about the incredible complexity of the human body.